This is a video that will talk about right hemisphere damage, also referred to as RHD. Okay, so what is it? Right hemisphere damage is a neurological problem caused by problems in cognition, communication, or both. Why are we interested in RHD? Speech-language pathologists are interested in right hemisphere damage because of the communication and/or feeding disorders that may accompany it. So let's now look at the symptoms of right hemisphere damage. These symptoms can be broken down into cognitive or communication. The cognitive symptoms are attention, perception, orientation, neglect, constructional impairment, anosognosia, prosopagnosia, and confabulation. Communication symptoms may include language and speech. It's important to note that cognitive deficits can lead to language deficits. So let's have a look at the cognitive deficits a little more closely. As we just stated, these include problems with attention, perception, and orientation. So now let's talk about neglect. Neglect is defined as failure to report, respond, or orient to novel or meaningful stimuli presented to the side opposite to a brain lesion. In other words, if an individual has a lesion on the right side of their brain, they will not notice stimuli that is presented on the left side of their body. Severe neglect is more frequent with right hemisphere lesions than left hemisphere lesions. And these lesions are usually found in the parietal lobe. What can cause these lesions? They can be caused by strokes, tumors, trauma, degenerative disorders, or any condition that can damage the right hemisphere. Neglect can occur through visual, auditory, tactile, or olfactory senses. However, visual is most frequently affected. Reading neglect can also be seen and is called neglect alexia or spatial alexia. Writing neglect is referred to as spatial agraphia. Constructional impairments involve difficulty drawing, copying designs, or creating designs. Constructional impairment is common with left hemisphere damage and right hemisphere damage. Individuals who show constructional impairment will produce reproductions that will be distorted, disorganized, disjointed, and they may contain inappropriate characteristics. Next is limb apraxia. Limb apraxia is when an individual has a working limb, for example an arm, and there's nothing mechanically or neurologically wrong with the mechanisms needed. However, the person cannot get the message from the brain to the arm. Right hemisphere damage is associated with a perceptual multimodal integration disorder rather than a modality-related sensory disorder. Right hemisphere damage is also associated with a disorder of bilateral perceptual multimodal integration of knowledge about the individual's own body. Next is anosognosia and prosopagnosia. Anosognosia is a real or feigned inability to perceive a defect on one side of the body. So this individual will deny the existence of the affected body part. This defect, though, can also show up in reasoning, decision-making, emotion, and feeling. An individual who shows anosognosia really does believe that there's nothing wrong with them. Prosopagnosia, on the other hand, is the inability to recognize faces, and they even can have trouble recognizing their own face. This is attributed to a lesion in the right temporal occipital area of the brain. Last, under cognitive deficits, is confabulation. Confabulation is when an individual strays from central themes. So these individuals typically show few or no problems in auditory or reading comprehension, as well as oral and written expression, but they may show irrelevant processes which do not relate to the stimuli. So they have trouble staying on topic or staying with the main idea. Okay, now switching gears over to communication deficits, which again, we broke down into language and speech. So the first language deficit we'll talk about is inferencing. Inferencing is defined as the ability to take previous knowledge and experience and apply it to the interpretation of the present situation. The ability to make a leap in judgment to a correct interpretation of an overall meaning. So we use inferences every single day. If you're talking to someone and you don't know the whole picture behind what they're saying, you can usually have an idea or an educated guess about what they're talking about. A person with right hemisphere damage does not possess that skill. Someone with right hemisphere damage also has trouble using abstract and concrete words. Story arrangement is a third language skill that someone with right hemisphere damage will have difficulty in. The fourth skill is comprehension of spoken narrative discourse. So this is the ability that someone has to listen to a story and to understand. So an individual will be able to listen and they'll have more correct responses when they're asked questions just about the main idea and not the small details. However, the inability to suppress or inhibit context-inappropriate interpretations has been shown to be an important predictor of narrative discourse comprehension. It should be noted that discourse impairments tend to be cognitively based. Last under language is pragmatic abilities. Individuals with right hemisphere damage are deficient in their pragmatic abilities, and they show characteristics such as tangentiality, egocentrism, and extremes of quantities. Moving on to speech. One area of big deficits is prosody. Prosody is features of speech which include intonation, stress, rate, rhythm, melody, pitch, volume, spacing between words, and intervals and pauses in conversation. Not only can prosody affect how someone talks, but it also can affect a listener's comprehension. An individual with right hemisphere damage may have difficulty also in comprehension and expression of emotional speech. Comprehension and expression of emotional speech may also impede understanding of extralinguistic cues, such as body language or facial expressions. Another area that someone with right hemisphere damage may show deficits in is comprehension and expression of linguistic information. This may be tied to an impaired tonal perception and to impaired attention. So on the expression side, an individual may not be able to perceive their lack of intonation or something like that. So they may produce speech which lacks prosody. And aprosodic speech is often described as flat, indifferent, devoid of expression and emotion, having little spontaneous prosody, computer-like, robotic, monotonous, and lacking the ability to modulate the voice to convey the subtleties of language. Lastly is communication abilities and inference impairment. Again, going back to inferencing, which was a language problem. The inability to use inferences properly leads to disturbances in producing informative content integrating narrative information, generating alternative meanings, comprehending and expressing emotion, and comprehending and expressing prosody. It's important to know that most of the language problems that someone with right hemisphere damage will have are due to an inference impairment. So, what causes right hemisphere damage? We can break causes down into two areas, major and lesser. So, the major causes are cerebrovascular accidents, which is a stroke, trauma to the brain, and brain tumors. The lesser causes are abscesses, infectious diseases, and degenerative diseases of the brain. One more point to make is that damage can occur anywhere throughout the brain. So there's going to be a range or a spectrum of symptoms and severities. And we're just going to talk about diagnosis very briefly. So there's 4 steps involved to reaching a diagnosis. First is establishing background information, giving a neurological evaluation, employing informal tests, and employing formal tests. Now, once we get into the tests, these look at cognition and communication. These steps of diagnosis are important because they will A, help reach a diagnosis, but B, it will be involved in prognosis, and even further along, it'll be involved in setting treatment goals and deciding what treatment is appropriate for the client. The reference used for this video was Language and Motor Speech Disorders in Adults, which was written by Harvey Halpern and Robert Goldfarb.